Welcome back to Secrets of Beauty and Wellness, and I have the amazing Vivi with me again from Vivify Aesthetics and Lake Nona, and I kind of wanted to make this a little bit different today. She had admitted that she's going through some hormonal changes and going through perimenopause, and I kind of want her to share her story, what are her symptoms that she's struggling with, because a lot of people don't know what are the symptoms of perimenopause, or is this symptom related to hormonal imbalances. So I just kind of want her to open up about her symptoms and have a conversation about it.
Thank you. So yeah, it's interesting because as a medical provider, and then when you start going through those changes, it's like, okay, like knowing like you're yourself, like, it's different when you're kind of educating your patients, your clients, like, these are the things that are happening. And then you're like, wait, that is what I'm feeling. So, I'm, open to say I am 46 years old. And so now, I'm having nights where, I just like, I'm freezing and then all of a sudden I'm hot and I just want all the covers off of me. The fan is full blast. The AC is turned down. I'm like, oh my God, is this it? Is this happening? And then just, my sleep pattern has definitely changed a lot.
What's happening with your sleep?
I feel like it's very broken. Like I don't have like, my sleep cycle's very like broken up. Like I'm just tired, then I'm wide awake. It's just not like, I don't have like a long period of sleep. Like it's very broken.
Did you notice that something happened? Like when did you notice like, oh my God, my sleeping pattern is actually changing?
Maybe 6 months, I would say. I would admit that. And I was like, well, maybe, being a new business owner, is it just because of the stress of my business? If I'm not sleeping well and just like, my thoughts are just kind of all over the place of thinking of my daily tasks. But then I'm like, okay. And then sometimes I'm like, no, that's maybe part of it.
But that's what we think. Like we always blame it to work. Like I'm stressed out, that's why I'm having these symptoms. And when you think about it, it's actually a hormone related symptoms. And I think I shared this before in the podcast, but you can start having symptoms of perimenopause 10 years before you actually get your last menstrual cycle. So let's put that into perspective, right? The mean age is 51 years old, but you can become menopause at age 45. So if you can become menopause at age 45, and technically you can have symptoms 10 years before.
I didn't even recognize or realize.
So it wouldn't be strange to have a 35-year-old patient complaining of symptoms of perimenopause. Mm-hmm. And unfortunately, it has happened that you go to your primary care provider and they will dismiss you 100%. Oh, you're 35 years old. This is anxiety.
You still have time.
It's not good. It doesn't make me happy knowing that there's a lot of women struggling with hormonal symptoms. And you share about the sleeping.
The mood.
So you are most likely going through perimenopause as we speak. And the good thing is that you put a stop and say, oh my God, this is happening. What do I need to do?
Yes.
To start making, feel better, honestly. So I know you're sleeping better now. You're taking magnesium, correct?
Yes, I started that.
Okay, how do you feel on the magnesium?
I feel like I'm getting a little bit more of that unbroken sleep pattern that I was getting before. So I think that's definitely kind of helped to stay asleep longer and just like a comfortable sleep.
Is it magnesium glycinate, citrate? What magnesium are you taking? Magnesium glycinate is the one that's to sleep, and then the citrate just to take magnesium, and then oxide for constipation.
Okay.
Anyway, that's just not a topic, but
it's
good to talk about magnesium.
That is definitely important because there's so many different types of magnesium. So getting the right one, that we're not doing it for other GI issues versus sleep.
And I know you touch on the mood swings and the I'm happy, then I'm not happy. And have you checked your hormones? Have you looked into your hormones yet?
You know what? I have not. And that's something
we make the worst patients, honestly.
I know. And that was something I was like, and I was just thinking about that the other day. I was like, you know what? I really need to go ahead and do my own, like, get my full panel of labs. It's hard sometimes that is trying to educate everyone else. This is what you need to do and do this. And then I'm like,
you were not doing that ourselves. So we need to make that example. Go get your blood work done.
Absolutely.
Because I wouldn't be surprised if your progesterone is in the floor. I wouldn't be surprised about that because progesterone is our happy hormone. It's the one that makes us sleep. It's the one that relaxes us. And believe it or not, there's data that low progesterone will lead to anxiety and depression. And that's why a lot of patients, with polycystic ovary symptoms, they have low progesterone levels and they feel a lot of anxious and they feel depressed and they're on antidepressant and all they need is progesterone 14 days. It's sad, how we're treating these chronic medical conditions without the proper medication.
Here, take a anti-anxiety.
That's what we're doing a lot. And I'm guilty. I used to do that as well. And, I was getting a lot of this perimenopause and menopause patients, and they were like, oh, you're just whining, like just deal with it. And now, we're changing. I'm changing my mentality, and I'm so happy I did because now I know I can tell you need progesterone because when your progesterone is low, you're gonna have depression, you're gonna have anxiety, you're not gonna be able to sleep. If you don't sleep, you're gonna feel worse. Like everything is connected, and I'm happy things are changing. And I know besides the
And then, weight fluctuations, that's
Yes.
another thing is sometimes if you're not checking your hormones and then why am I still, and I checked my thyroid, that's one, it's normal. So what else is contributing to my weight increase?
hormones. But touching on thyroid, actually, I love talking about this. When you tell me, let's say you're a patient and we're on a consult, and you tell me, oh, my thyroid was normal. What do you mean by your thyroid was normal? Do you know what was tested? Because when you go to your primary care or endocrinologist, your thyroid is fine. And then you're like, oh, then my thyroid is fine, but they only check a TSH.
Yes.
So we know that TSH is thyroid stimulating hormone, but it's not the full picture of a thyroid panel. How do you feel about that?
And I think that's part, yeah. So it's like when I also too, like part of like with like, the other side part of like when I'm doing like weight loss and we're reviewing labs and I was like, okay, they checked your thyroid. What did they just check your TSH? So there's like basic minimal stuff that is being ordered on the primary care side. And I said, okay, well, go ahead and request a little bit more data so that we can see and make sure like you are the right candidate for either weight loss or if we're considering doing hormone treatments, if there's something else that we need to kind of, before we get you started on this, we need to make sure that everything is kind of balanced out.
Exactly. Because I do get a lot of patients because they're gaining weight and they automatically want to jump on GLP-1s. I'm like, stop down. No, not yet. There's other things that are making you be overweight and being obese. And for the most part, it's a hormonal imbalance. And I cannot tell you how many times I've gotten patients that are telling me their thyroid is fine. And when I actually run a full thyroid panel, and by that I mean T3, T4, TPO, and reverse T3, and they actually have autoimmune hypothyroidism. And they have no idea because their TSH was normal. But you were missing a diagnosis. And that's why your patient is not feeling any better. So always demand for a comprehensive blood work. I don't care what your primary care is telling you. You don't need that. There's no point. Your insurance is not going to cover because they will give you excuses. Because I did that at one point. You don't need that. Your insurance is not going to cover it. But you need a full panel. You definitely do need a full panel. Are you having any other symptoms on this perimenopause journey?
I mean, the weight fluctuation is part of it. I think for me right now, the most part is like the mood, the sleep pattern, the hot flashes. Those are right now are my major.
Which are symptoms.
So as far as what if somebody's coming to you, then like what kind of labs would you kind of recommend for someone who's, wanting or considering hormone?
I will get like 5 tubes of blood work you allow me to. That's the first thing I tell to my patients. If you really want comprehensive blood work, we're going to do a comprehensive blood work. I get your basics, your CBC, your CMP, we get your lipids, we get your cortisol levels, which is really important because if you're stressed out, your cortisol level comes up. And if your cortisol level comes up, you won't be able to lose weight. I don't care how much you try, you won't. Yeah. And then I need to know your insulin levels. A lot of people confuse insulin with sugar because they think insulin means diabetes and not necessarily means diabetes. But insulin is the hormone that makes you store fat. So if your insulin is low, you will be able to burn fat. If your insulin is high, trust me, you're not gonna be able to lose fat. So I wanna check your insulin levels because if they're high, hey, this is one of the reasons why you can lose weight. Let's work on the insulin before we go the GLP-1 route. So I check that. I check a full titer panel, which we already discussed. I check inflammation markers. I think knowing if your body is going through inflammation is extremely important. So I do check your set rate. I check your CPK as well. For me, that's important. I know people say, oh, CPK is cardiac. Not all the time. No, I need to also know your inflammation markers. I check your hemoglobin A1C, which is, of course, your diabetes test. For the most part, this is being done in your primary care. They do.
As part of the protocol, yeah.
Your normal blood work includes that A1C if you're lucky. Lipid panel, but I also want to see CBC and I want to see vitamin B12, which is really important. If your vitamin B12 is below 500, you're gonna have problems. Like, I don't care what people say, oh, that's normal. No, that's not optimal. There's a difference between being normal and what's being optimal. And if it's below 500, I would recommend you start supplementation of vitamin B12. Vitamin D, the holy vitamin D.
I don't know. I feel like everyone is really deficient.
They are. I am.
Mine's is super low.
I am. I think the last time I checked, which is last year, I was 27. And I was like,
Same.
What? How am I 27? It doesn't make any sense. I take oral vitamin D. Don't tell me I'm deficient when I'm consistently taking vitamin D. So I switched things. I actually inject myself with vitamin D because I know that for me, I'm not absorbing oral vitamin D. So I needed to switch. So I switched to injectable vitamin D. I'm not saying you have to, but if you're noticing that you are taking supplementation and your levels are still low, then there might be something going on with your gut that is just not absorbing the nutrients. So we'll switch the route. What else do I check? I might be missing something as usual. Folic acid is important. Ferritin is important. TIBC is also important. And for some patients that I do think there's something wrong with their gut, I also do a microbiome gut evaluation as well. There's so many people with candida. So many people, and candida is this fungus that messed up your whole intestines, and it makes it difficult. It causes inflammation in your intestines, and if you have inflammation in your body, pain is just too much going on. So I also like to check candida if there's a lot of gut issues. Issue with that is that it would never be covered by insurance. We live in this world that insurance don't want to cover anything related to functional medicine, and the patient will have to pay out of pocket for this, which can be costly. Well, it's costly, but I would say it's an investment in knowing what's going on. And I think it's like $350 to know your gut health. But is it worth it? Yes, because if I had candida, I want it gone.
Yeah.
Out of my system so I can start working this. So I think $350 is really worth it to do that. The other test that I like to check is H. pylori.
Yes.
Because H. pylori can cause cancer in your stomach. And you can easily get H. pylori from uncooked vegetables and fruits. And I have a lot of patients. I have acid reflux, stomach this and stuff. Let's check your H. pylori. And that can be covered by insurance. So demand that you want to test for H. pylori. They can do this by stool test. Very easy, very quick, or they can do that through an EGD when you go under for like your colonoscopy in your EGD. But demand answers. I think that's all. I could be missing, of course, something, but for the most part, that's
very thorough.
I have to, because how am I going to know what's going on with you? I do want to help you, and if you're investing in your health, I have to do my best to make sure you are your best. So I do a comprehensive blood work. And the good thing is that if it's not covered by insurance, that's okay, because I have partnered up with Access Lab. So make sure you talk to them. When I partner up with Access Lab, my patients only pay $350.
Yes, they're great. Yes, I have used them.
Full panel, which for me, that's crazy Because if you go through insurance, I have a lot of patients telling me they didn't cover my vitamin D. I got a bill for $350. I got a bill for my B12 levels. I got a bill for this because I didn't need it in my hormones. Like, because I also check your progesterone, your testosterone, your estradiol, your estrone, and estriol. People don't know there's 3 types of estrogens in their body, but there are. That's another topic. But I check all that with your testosterone because I think we need testosterone and we produce testosterone. It just started declining by age 40, unfortunately. That will be the full panel that I check on my patients. But that's what I wanted to say today. If you have any questions, follow Vivi at her med spa.
Vivify Aesthetics.
Follow her on Instagram if you're in that area. If you're in Apopka, feel free to follow me. As you know, I'm always educating, posting videos out there, and kind of dropping this video every week. So stay tuned for the next ones, and I hope you have a great rest of the day.